If we're constantly living in this fight, flight, or freeze, constantly wondering where our next meal, where we're going to sleep at night is coming from, that trauma lives in our body. And for a lot of us, that is generations long. That is not new. We can't break cycles if we don't have our basic needs met. And housing is a huge part of that. And that constant instability keeps you stuck in that fight, flight, or freeze mode.
I'm Patrick Howard. I'm the CEO of the Housing Authority of Travis County. We really believe that there's an important connection between housing stability and mental health outcomes. Stable housing not only fosters mental well being, it also is an important social indicator of health.
So I think the data tells us two stories. The first story is encouraging, and that is that Black, Indigenous, and people of color are seeking help. The other story is that health disparities remain. And so when we look at Black, Indigenous, and people of color, the disproportionate outcomes that are represented when it comes to mental health and health inequities, that really reminds us that mental health does not exist in isolation. And it also reminds us that we have to be mindful of the conditions in which people live.
The barriers are stacked, right? It's not just systemic, it's financial. There's a trust issue, the historical piece, the stigma around what it means to ask for help in general, the barriers around just asking and just admitting to yourself that I'm not well, I need help. And I've tried to get help before and that hasn't gone well. And so, how can I believe and trust that this time it'll be any different?
It's not enough just to make services available.
Right.
And we, as organizations and entities, have to be able to ensure that those systems are worthy, that the systems that we work in, that they're worthy of the trust of those people who have had historical experiences of being misunderstood and being overlooked. I think stable housing, it really is the foundation that makes everything possible. And so, to Vanessa's point, how can someone focus on healing if they don't know where they're going to sleep tonight? How can they focus on healing if they don't know if next month they're going to have stable housing? And so housing is really the most powerful intervention tool that we have.
What we're seeing is more people are asking for help now than they ever have before. People are more vocal about it. And that removes the stigma. That takes away this fear that if I ask for help, that means something's wrong with me. I think when we can talk about this secret that a lot of us hold or secrets, the shame starts to dissolve. And I think that's happening more. And that gives me a lot of hope.
The other thing that gives me hope is the resilience of Black, Indigenous, and people of color.
That's right.
I'm going to say that again, the resilience, because in these extraordinary challenges that we're facing, we still demonstrate and exhibit that resilience and that strength on a daily basis, not only for ourselves, but for our families and for our communities. And that is nothing but hope.